Which of the following complications of MI is most likely responsible for this patient's presentation? A 62-year-old man with a history of hypertension presents to the emergency department with sudden onset severe chest pain. An ECG reveals ST segment elevation in the anterior lead. He is diagnosed with acute MI and receives thrombolytic therapy. The patient returns 3 weeks later, complaining of persistent chest pain, fatigue, and dyspnea. Physical examination shows a new systolic murmur and a palpable thrill. Which of the following complications of MI is most likely responsible for this patient's presentation? Ventricular pseudoaneurysm, VSD, mitral regurg, pericarditis, or cardiac tamponade. Okay, so I'm thinking like this. There's a lot of like complications that can happen post MI. When I think of this far, I think of more of like ruptures or like things like that. So more ruptures, more like damage that's already been done, because I think that like mitochondria start coming in and they start tearing things apart. Like we're closer to day 7. And so to me, nothing is giving like me the idea of like cardiac tamponade here, especially like a new systolic murmur, palpable thrill. So I'm not going to go with that. I think my initial just gut reaction is like ventricular pseudoaneurysm. I think that happens actually like 2 to 14 days though. I don't know why my gut said that. A new systolic murmur and a palpable thrill, which are the following complications of MI. Um, I don't know. I'm leaning. I think that's. I think there's a true ventricular aneurysm and there's a pseudoaneurysm. Um, I think the pseudoaneurysm is going to be later. I mean, earlier for some reason. I think the true aneurysm is later. So I don't know. Pericarditis is, to me, didn't see much about that. Mitral regurg or VSD. I don't know 100%.
All right, then sometimes you got to pick an answer and let's learn from it. Me personally, I can't remember if I'm being honest.
Yeah. I low-key think, man, I guess I'll just stick with it. I don't know.
Well, the only thing that if I were to kind of put my answer into the ring, okay, because I can't remember the timelines anymore. I used to have that down pretty pat, but there's just a lot of things can happen obviously after an MI, right? The
Yeah.
key that gets me a little bit here is that he has ST elevation and anterior leads, right? And what does ST elevation make you think of? Like another
Like
MI.
a heart attack.
Yeah, but obviously we don't have the answer. So then what else can give you elevated STs?
Yeah, pericarditis can.
Yeah, so in my mind, that's what I would go with, but I can't remember the timeline. And what is another name for pericarditis after an MI? Do you remember the name?
It's like post MI pericarditis. I think it's exactly just like how that's described. I'm not exactly sure actually.
I think it's called Dressler syndrome, if
Oh,
not.
Dressler syndrome is, yes.
So that's what my thought process of this question would be using, because the ST elevation is pretty specific for pericarditis, but that's just but I'm not sure. So
I honestly would agree with that. So, I mean, yeah, we can go with that one.
all right, let's see. All right, so we're both wrong. So let's see kind of
Totally
what's
fine.
yeah, but pericarditis, that's right. It doesn't cause a murmur. So that's something that we didn't look at a whole picture. So let's look at this. Ventral septal defect, patient's history, acute MI, new systolic murmur, palpable thrills, complicated ST can a complication of MI due to necrosis of IV septum. That's true. Results to the left or right shunting, increased volume load on the right side of the heart, leading to symptoms of chest pain, fatigue, dyspnea. But let's look at the other ones here. Typically presents with chest pain and heart failure, less likely cause new systolic murmur. Okay, regurg here as a complication, papillary rupture, but is less likely to cause a palpable thrill compared to VSD. Okay, pericarditis can occur, typically presents sharp pain. So yeah, I guess it has to be sharp pain and then it usually gets better when you sit up leaning forward.
Yeah.
Unlikely to cause new systolic murmur or palpable thrill, and then you need Bextride for cardiac tamponade, right? Jugular venous dissension, hypotension, muffled heart sounds, which they don't have.
Yeah.
So I guess the best answer here would be VSD for sure.
Makes sense.